Last year, a 39-year-old teacher from London started feeling tired all the time. She thought it was just her busy schedule. At night, she would wake up soaked in sweat, but she blamed it on the summer heat. She lost nearly 5 kilos without trying, and her friends even complimented her on how slim she looked. But soon, she began to bruise easily, sometimes from just leaning on a table. When she finally went to the doctor, the truth was shocking. The tests revealed blood cancer. What she thought were ordinary, everyday problems were actually her body screaming for help. And her story is not rare. Every year, thousands of people ignore or misinterpret the early symptoms of blood cancer. Why? Because they look so normal: fatigue, night sweats, weight loss, bruising, frequent infections, all things we've experienced and brushed off at some point. But sometimes, these are not signs of stress or aging. They are red flags that something serious is happening inside the blood, bone marrow, or lymph system. That's why today, in this episode of Home Cooking and Home Remedies, we're going to talk about the top 20 shocking symptoms of blood cancer that you might be ignoring right now. Each one is backed by medical research, explained in simple language, and shared so you can protect yourself and your loved ones. This is not about spreading fear. It's about spreading awareness. Because early recognition doesn't just improve chances of treatment, it can literally save lives. So stay with me as we uncover the hidden signs of blood cancer and learn when to take them seriously. One of the most dangerous things about blood cancer is not just the disease itself, it's how well it hides. Unlike some other cancers that form lumps or cause sudden sharp pain, blood cancer creeps in quietly with symptoms that look like ordinary life. Think about it. Fatigue? We blame it on long work hours. Night sweats? We think it's the weather or hormones. Weight loss? Many people are even happy about it. Frequent infections? We assume our immunity is weak because of stress or lack of sleep. Each sign feels so easy to explain away, so we move on and ignore it. The medical reason behind this is that blood cancer begins in the bone marrow and lymphatic system, the factories where blood cells are made and managed. When cancerous cells take over, they crowd out the healthy red cells, white cells, and platelets. But this happens slowly, in stages. So instead of one dramatic symptom, you get small, gradual changes that feel like normal everyday problems. Doctors often call these symptoms nonspecific. That means they overlap with many other harmless conditions. A fever could be a simple infection, bruising could come from low vitamins, and fatigue might just be lack of sleep. But when these symptoms persist, cluster together, or keep getting worse, that's when they become red flags for something deeper. And here's the key: people often wait weeks or months before seeing a doctor, because the signs don't feel urgent. Unfortunately, this delay is exactly what gives blood cancer the upper hand. By the time many patients realize something is wrong, the disease has already advanced. That's why awareness matters. When you know what to look for, you can connect the dots earlier, push for tests, and catch blood cancer at a stage when treatment is far more effective. Now that we know what blood cancer is and why its warning signs are so easy to miss, it's time to walk through the 20 most shocking symptoms you must never ignore. These are not rare, dramatic signs. In fact, that's what makes them so dangerous. Most of them feel like everyday problems: tiredness, fevers, rashes, even itchy skin. But behind them, there may be something far more serious happening inside your blood, your marrow, or your lymphatic system. I'll break each symptom down in simple words: what it looks like, why it happens, and when you should take it seriously. And remember, while these signs don't always mean cancer, when they last for weeks, cluster together, or keep getting worse, they should never be ignored. Top 20 shocking symptoms of blood cancer. 1. Unexplained fatigue and weakness. We've all felt tired after a long day, but fatigue caused by blood cancer is on another level. Imagine waking up after sleeping 8 or 9 hours, yet feeling like you barely slept at all. It's not the kind of tiredness a cup of coffee can fix. This happens because blood cancer often causes anemia. The bone marrow produces fewer red blood cells, so less oxygen is delivered to your muscles, brain, and organs. One patient described it like this: I would walk from my bedroom to the kitchen and feel like I had just run a race. This kind of exhaustion is deep, overwhelming, and persistent. Unlike normal tiredness, it doesn't improve with rest, and it slowly chips away at daily life, making even brushing your teeth or cooking dinner a struggle. 2. Persistent or unexplained fever. Fever is usually the body's defense against infection, but in blood cancer, it's a sign that the immune system is under attack. Cancerous white blood cells don't fight germs properly, leaving the body vulnerable. The immune system responds by raising the temperature, even when no clear infection is present. These fevers are often low-grade, coming and going without reason. Patients describe them as flu-like feelings that never fully leave. Unlike viral fevers that pass in days, these can linger for weeks or recur again and again. A study from the American Cancer Society notes that unexplained, recurring fever is one of the hallmark signs of leukemia and lymphoma. 3. Drenching night sweats. There's a difference between mild sweating at night and drenching night sweats linked to blood cancer. In this case, you wake up soaked, the sheets are wet, your clothes need changing, and sometimes you even have to lay a towel down just to sleep again. This happens because cancer cells release substances called cytokines, which confuse the brain's thermostat. Even in a cool room, the body reacts as if it's overheating, leading to sudden waves of intense sweating. Many patients dismiss it as hormonal changes, stress, or menopause, but doctors warn that persistent, drenching night sweats are one of the classic B symptoms of lymphoma. 4. Unintentional weight loss. Losing weight without dieting sounds like a blessing, right? But when the pounds drop off without effort, it can be a dangerous warning sign. In blood cancer, abnormal cells use up a tremendous amount of energy. They hijack the body's fuel, causing metabolism to speed up abnormally while appetite drops. A person may notice their clothes becoming loose, their face looking thinner, or friends saying, "You've lost weight." But they weren't even trying. Doctors caution that losing more than 5 to 10% of body weight within 6 months without a reason is a serious red flag. This symptom often appears alongside fatigue and night sweats, forming a dangerous trio that should never be ignored. 5. Easy bruising and bleeding. Picture this: you bump your arm lightly against a desk, and the next day, there's a big purple bruise. Or your gums bleed every time you brush your teeth. For many, this is one of the most alarming early signs of blood cancer. The reason is simple: the disease lowers platelet counts, which are the tiny cells responsible for clotting blood. Without enough platelets, even small injuries can cause prolonged bleeding. Some people experience frequent nosebleeds, tiny red or purple spots on the skin, called petechiae, or heavy menstrual bleeding in women. One patient with leukemia recalled, "I thought I was just clumsy because I was bruising all the time. I never imagined it was cancer." The truth is, when bruises appear too easily or bleeding takes too long to stop, it's not just a minor issue, it could be your blood crying out for help. 6. Tiny red or purple spots on the skin, petechiae. Imagine looking at your skin and noticing clusters of tiny red or purple dots, almost like a rash, but they don't itch or fade away quickly. These are called petechiae. They happen when blood vessels under the skin bleed because there aren't enough platelets to stop it. In blood cancers like leukemia, platelets are crowded out by cancer cells, leaving your body unable to seal even microscopic leaks. Parents often notice this symptom in children, especially on the legs or arms, and mistake it for an allergy or insect bites. But petechiae don't behave like regular rashes. They don't blench, turn white, when pressed, and they often keep spreading. Doctors warn that this subtle skin sign is one of the most overlooked early symptoms of leukemia. 7. Frequent or severe infections. Normally, your immune system acts like an army, fighting off germs before they take over. But in blood cancer, the white blood cells, your soldiers, are either too few or defective. That means even simple infections like colds, sinus problems, or chest infections become frequent, harder to treat, or unusually severe. A person might find themselves on antibiotics again and again, or constantly battling sore throats and fevers. Children may catch infections repeatedly at school, far more than other kids. Doctors often see this as one of the earliest clues. The immune system is waving a red flag, but people blame it on weak immunity or seasonal bugs. 8. Painless swollen lymph nodes. Have you ever noticed a lump under your neck, armpit, or groin? Most of the time, swollen lymph nodes mean your body is fighting an infection. But in blood cancers like lymphoma, the swelling is painless, firm, and lasts for weeks. These lumps are cancerous lymphocytes building up inside the nodes. Many patients ignore them because they don't hurt, and we usually associate cancer with pain. A young man once shared that he felt a small lump under his collarbone, ignored it for months, and later learned it was lymphoma. The absence of pain makes this symptom dangerous, because it's easy to dismiss. 9. Persistent cough, chest tightness, or breathing trouble. Sometimes, blood cancers cause lymph nodes in the chest to enlarge. When this happens, they press on the airways and lungs, leading to a chronic cough, chest tightness, wheezing, or shortness of breath. Patients often mistake this for asthma, bronchitis, or even smoking-related issues. One teenager with Hodgkin lymphoma described it as a pressure in my chest that wouldn't go away. What makes it tricky is that these symptoms don't always come with fever or phlegm like a normal chest infection. Instead, it's a stubborn, dry discomfort that lingers for weeks or months. 10. Fullness or pain under the ribs, enlarged spleen or liver. The spleen and liver filter the blood and help fight infections. But in blood cancer, these organs can swell with abnormal cells, causing pain, fullness, or swelling in the upper abdomen. Sometimes patients say they feel full after eating just a small portion, as if there's no room in the stomach. Doctors often discover enlarged spleens during physical exams or scans, but patients usually ignore the signs until discomfort grows. Left untreated, an enlarged spleen can even rupture, creating a medical emergency. This is why persistent abdominal discomfort, especially if paired with fatigue or weight loss, should never be ignored. 11. Bone or joint pain. Blood cancer begins in the bone marrow, the factory where blood cells are made. When abnormal cells multiply, they push into the hard outer bone and surrounding joints, causing deep, aching pain. Unlike muscle soreness from exercise, this pain doesn't go away with rest. It's often worse at night or early in the morning. Patients describe it as a dull, persistent ache, sometimes in the ribs, back, or hips. In children with leukemia, bone pain is one of the earliest symptoms parents notice. Kids may limp or complain of leg pain, and it's often mistaken for growing pains. But unlike normal growth aches, this pain worsens over time instead of fading. 12. Back pain with bone tenderness or fractures. In multiple myeloma, cancer cells damage the bones themselves, making them fragile. This leads to sudden fractures from minor accidents. A simple fall, bending down, or even coughing hard can cause a break. Patients may also feel persistent back pain, often in the spine, that worsens when standing or walking. A woman once described her experience. I thought I had pulled a muscle, but when I bent slightly, my back cracked. It turned out my spine was weakened by myeloma. If bone pain combines with unexplained fractures, it's a serious warning sign. 13. Severe tiredness with pale skin and shortness of breath. Anemia caused by blood cancer doesn't just make you tired, it also makes you look and feel pale. Without enough red blood cells, less oxygen circulates, leaving skin, lips, and even the inside of eyelids unusually pale. Climbing stairs, walking short distances, or even talking can make you short of breath. Many people mistake this for being out of shape or aging. But when breathlessness combines with pallor and constant fatigue, it usually points to something deeper than lifestyle. 14. Itchy skin or unexplained rashes. One surprising symptom of blood cancers, especially lymphomas, is itchy skin. The itching is not like a normal mosquito bite, it's widespread, persistent, and sometimes worse at night. It can occur with or without visible rashes. Doctors believe this is caused by chemicals released by cancer cells that irritate the skin's nerve endings. Some patients also develop unusual rashes or hives that don't respond to normal creams or allergy medications. The frustration of constant itching often keeps people awake at night, adding to the fatigue cycle. While most itching has harmless causes, persistent, unexplained itching combined with other warning signs should never be ignored. 15. Headaches, dizziness, or feeling faint. Blood cancers that cause very high white cell counts or severe anemia can affect circulation to the brain. The result? Headaches, frequent dizziness, blurred vision, or even fainting spells. These are not the usual headaches relieved by painkillers. Instead, they can be persistent, severe, and sometimes accompanied by pressure behind the eyes. One leukemia patient recalled collapsing at work after weeks of ignoring headaches and lightheadedness. Doctors later explained that his blood had become unusually thick from excess white cells, reducing oxygen flow to the brain. 16. Abnormal thirst, frequent urination, nausea, or constipation. In multiple myeloma, cancer cells can release proteins that cause bones to break down, releasing calcium into the bloodstream. High calcium, or hypercalcemia, creates a dangerous chain reaction. Patients often feel unusually thirsty, drink lots of water, and then need to urinate more often. Along with this, they may feel nauseated, lose their appetite, or suffer constipation that doesn't respond to simple remedies. One patient said, "I kept waking up at night to drink water and run to the bathroom. I thought it was just age, but it was calcium in my blood going out of control." High calcium is not only uncomfortable, it can also damage the kidneys if ignored. 17. Foamy urine, reduced urine, or swollen ankles. The kidneys are one of the first organs to suffer in blood cancers like myeloma or advanced leukemia. Abnormal proteins produced by cancer cells clog the kidney's filtering system. As a result, urine may become foamy or bubbly, a sign of protein leakage. Some people notice their urine output decreases, or their ankles and feet swell from fluid buildup. Doctors warn that once kidney function is compromised, the whole body suffers, toxins build up, causing fatigue, nausea, and itching. Kidney changes linked to blood cancer are often subtle at first, so these early clues shouldn't be ignored. 18. Persistent abdominal pain or feeling full quickly. An enlarged spleen or liver is another warning sign. When these organs swell with abnormal cells, they press against the stomach. Patients say they feel full after just a few bites, or experience discomfort under the ribs. Some describe it as a dull, dragging pain on the left side of the belly. Because digestive issues are so common, many people assume it's acidity, ulcers, or gastritis. But when fullness or abdominal pressure combines with weight loss, night sweats, or fatigue, it points towards something far more serious happening in the blood. 19. Recurrent chest or sinus infections that don't clear. Another red flag is when infections just keep coming back. For example, constant sinus infections, bronchitis, or pneumonia that never fully resolve. This happens because blood cancer weakens the immune system either by destroying healthy white blood cells or replacing them with abnormal ones. One patient shared, "I was always on antibiotics. My cold would get better for a week and then come back even worse. I never thought it was cancer." Frequent, long-lasting, or unusually severe infections are a classic sign of leukemia and lymphoma. 20. The B symptom trio: fever, night sweats, and weight loss. Doctors group 3 of the most important red flags into what they call B symptoms: unexplained fever, drenching night sweats, and significant weight loss. When these 3 appear together, especially in lymphoma patients, it's a strong signal that the disease is active and spreading. Many patients first come to doctors with this trio, thinking it's just a stubborn viral illness or stress-related problem. But when fever, sweats, and weight loss persist for weeks or months, doctors treat it as a major cancer warning sign. Recognizing this trio early can lead to faster diagnosis and better treatment outcomes. It's true that most of these 20 symptoms can come from common, harmless causes like stress, infections, or aging. But the danger lies in duration and combination. Doctors say you should start to worry if a symptom lasts longer than 2 to 3 weeks without improvement. Symptoms cluster together, like night sweats plus weight loss plus swollen glands. The signs are getting worse over time rather than improving. For example, if you're tired for a week after staying up late, that's normal. But if you're exhausted for a month, dropping weight, and waking up drenched in sweat, that's a red flag. Awareness means connecting the dots earlier, instead of brushing them off. What tests doctors may order. If you or someone you love shows these warning signs, the good news is that the first steps to diagnosis are simple. Doctors usually start with a CBC, complete blood count. This is a routine blood test that checks red cells, white cells, and platelets. It can reveal whether your blood is behaving normally or if there are abnormal patterns that need a closer look. Next may come a blood smear, where a lab looks at the shape and maturity of blood cells under a microscope. If results are unusual, further tests like LDH, uric acid levels, or imaging scans may be ordered to check for enlarged lymph nodes, spleen, or liver. The most definitive test is a bone marrow biopsy, where a small sample of bone marrow is examined. It sounds intimidating, but it's a routine procedure doctors perform every day. The key message: testing early is better. Even if it turns out not to be cancer, you'll get peace of mind and catch other health issues early. Some warning signs require immediate medical attention, not waiting weeks. If you or a loved one experiences any of the following, don't delay, go straight to the ER. Severe bleeding that doesn't stop, like nosebleeds or gums bleeding uncontrollably. Extreme shortness of breath or chest pressure. Sudden confusion, dizziness, or extreme drowsiness. Very high fever with chills that doesn't come down. Rapid swelling in the face or neck, which can signal blocked blood flow in the chest. These symptoms mean the disease may already be affecting critical body functions. Immediate treatment can be life-saving. Now, before you panic, let me reassure you. Having one or two of these symptoms does not automatically mean you have blood cancer. Most of the time, they're caused by simple conditions, infections, vitamin deficiencies, stress, or lifestyle issues. The purpose of this episode is not to frighten you but to make you aware. Because when these symptoms persist, cluster, or worsen, they should not be ignored. Early testing brings answers, and if it is cancer, catching it early means treatments work better and survival rates improve. Awareness gives you control, not fear. So, let's recap. Blood cancer hides behind ordinary symptoms: fatigue, fevers, sweats, bruising, infections, things we often dismiss. But when they last, when they combine, when they get worse, they may be the body's way of waving a red flag. We walked through the 20 shocking symptoms, the times when you should worry, the tests doctors use, the emergency red flags, and why reassurance matters. Here's my challenge to you: don't ignore your body's signals. If something feels wrong for weeks, don't just Google it, don't just wait it out, see a doctor, ask for a CBC, and push for answers. And share this episode with someone you love. You never know, the knowledge you pass on today could save a life tomorrow. Thank you for listening to Home Cooking and Home Remedies. Stay healthy, stay aware, and remember, awareness is the first step to healing.